One day, you take your blood pressure pill. The next day, your heart starts pounding and you are not even moving. Then, all of a sudden, your ankle starts to swell. You feel dizzy and lightheaded like the room is tilting on you. You try to brush it off. Maybe I'm just tired. But deep down, something feels off. And you are not alone. Millions of people feel this way and most have no idea what is actually causing it. Are you one of them? It could all be linked to one pill, amlodipine. Amlodipine is one of the most prescribed blood pressure medications in the world and over 50 million Americans take it. But here's the part that no one is telling you. Amlodipine has side effects your doctor may never mention unless you bring it up first. Shocking, right? Now, don't get me wrong. This drug can save lives, okay? But if it is changing the way you feel, you deserve to understand why. Before we go any further, let me tell you something that could change everything for you. Well, I have created a practical, science-backed program called the 21 Blood Pressure Reset, and it's designed specifically for people like you who wants to take control of their blood pressure without relying solely on medications. Each day, you'll get clear steps, meal tips, and lifestyle strategies that actually work. No fluff, no guesswork, just real doable changes that can start showing results in as little as a week. If you are tired of feeling powerless over your numbers, this course is where you start winning back control naturally. You'll find the link in the description below. Take the step because your health can't wait, okay? So let us break it down. I mean the truth about amlodipine that no one is telling you. Today we are breaking down the top 10 side effects of amlodipine based on clinical data and real patient experiences. And some of them are minor. I mean, you could be living with them right now without making the connection. And later in this video, I'll show you which symptoms may mean your dose is too high or that you need to switch medications completely. So don't skip ahead. Let us start with something almost too easy to overlook, that floaty, lightheaded feeling. Dizziness is one of the most common side effects of amlodipine, especially when you are just starting the medication or are taking a higher dose. Well, it usually shows up when you go from sitting or lying down to standing, that hua feeling. That is called orthostatic hypotension, and it happens because your blood vessels are suddenly relaxing and your blood pressure drops too fast. The tip is to get up slowly, stay hydrated, and track how often it happens. If it doesn't go away after a few weeks, your dosage may need adjusting. Next up, we have swollen ankles or puffy legs that makes your shoes feel tight. That's not just aging, that's edema, and it is directly linked to how amlodipine works. Amlodipine widens blood vessels, which can cause fluids to leak into your tissues. It's more common in women, especially in people taking the higher dose, that is the 10 mg dose. If both legs are swelling and it gets worse by the day, talk to your doctor. It's common but not something you should ignore, okay? Number 3, we have weight gain. This one throws people off. You gain 3 to 5 pounds in a week and panic. But here's the thing, it's often just water, not fat. That swelling we just talked about earlier, it adds weight. But, and this is big, if you have heart failure, any sudden weight gain could signal something serious. So if the scale jumps fast, especially along with shortness of breath, call your doctor immediately. Number 4, we have angioedema. It is a rare reaction that causes sudden swelling in your face, lips, or throat, and it can block your airway. Shocking, right? If you ever notice those symptoms while on amlodipine, don't wait. Get emergency help right away. Number 5, we have fatigue. This one is sneaky. You start dragging through your day, needing naps, maybe blaming your age or stress. But fatigue is a real side effect of amlodipine, especially in the first few weeks. The reason here is because of amlodipine use, your body is adjusting to lower blood pressure, which can make you feel like you are running on a half battery. But the good news is, it usually gets better. But if it doesn't, don't just live with it. Check in with your doctor. If you are serious about managing your blood pressure day to day, there are a few tools I personally recommend, not because they are trendy, but because they actually help. Whether it is a clinically validated home blood pressure monitor, natural supplements, or even the kind of salt you cook with, I've listed the best one I trust down in the description. I've gone through them carefully, and these are the exact kind of resources I'd recommend to my own family. When you use those links, you are not only supporting your health, you are also helping me keep this channel going so I can keep supporting you. It's a win-win. Back to our list of the side effects of amlodipine. 6. We have flushing. That sudden wave of warmth on your face or neck like a hot flash or blushing, and it is caused by your blood vessel opening, okay? It's more common in women at higher doses, okay? And while it's usually harmless, it can feel uncomfortable and embarrassing. Number 7, you have heart palpitations. Have you ever felt like your heart is keeping beat or pounding for no reason? That could be amlodipine too. While palpitations are usually not dangerous, they can be scary, and in some cases, they are a sign your heart needs a closer look. This side effect is also more frequently reported by women, and again, higher doses increases the chances. Number 8, we have nausea or stomach pain. Let us be real, nobody likes nausea, and if amlodipine upsets your stomach, you are not alone. This side effect is mild for most, but if it happens on an empty stomach, try taking it with food. Even a little snack can make a difference. Number 9, we have low blood pressure, commonly known as hypotension. Ironically, your blood pressure medications can drop it too low, especially if you have other blood pressure medications. For these side effects, you will experience symptoms such as blurred vision, dizziness, fainting, and even confusion in severe cases. If this starts happening often, especially right after taking your pill, you need a medication review. Number 10, we have muscle tremors or stiffness. This one is rare, but if your hand starts shaking or your muscle feels stiff or jittery, don't brush it off. A few patients in clinical trials reported these symptoms, which could interfere with fine motor skills or daily tasks. If there is any new and other muscle behavior, get it checked out, okay? The bottom line is, amlodipine helps millions, but no drug is a one-size-fits-all. Knowing the risks helps you speak up, ask better questions, and take charge of your health. If you are feeling off since starting your blood pressure medications, trust your instincts. Your body is trying to tell you something. And listen, if you've been dealing with high blood pressure and feel like you are navigating it alone, I want to change that. I offer one-on-one private guidance to walk with you step by step through your journey. I'm not just reading from the textbook. I have over 8 years of pharmacy experience and a deep respect for what you are going through. And I'll be honest with you, if there's something I don't know or understand, I'll say it upfront, then consult my network of specialists and get back to you with a real answer. I handle every person who reaches out like a real human being, not just as a number in a crowded inbox. Unlike bigger channels where your questions may get buried, I give each case my full attention until we reach clarity together, okay? If that sounds like the kind of support you've been waiting for, just check the description below for how to reach me directly. If this video helped, hit the like button and consider subscribing. We break down complex health info in simple, real talk terms, okay? And if you want to dive deeper into natural ways to support healthy blood pressure, check out the next video. See you there and stay healthy.